Hi everyone, welcome to the Aesthetics and Wellness podcast. Today we are talking about eyes. We've talked about dark hollows under the eyes. We've talked about the mid-cheek groove. We've talked about eye bags, puffiness, fat protrusion, and what treatments do and don't work. We've also talked about creams and given you some recommendation about what you can do at home to improve the under eye area and prevent age-related changes and concerns in this area. If you have any questions, please get in touch. And as always, please like, subscribe, and share our podcast. The more you do that, the more we can grow and help you. Thank you. Hi, Sophie.
Hello again.
So we are here again on the podcast, talking this time about one of the major concerns of all aging people, men, women alike. And this is feeling tired, looking tired, tired looking eyes, dark circles under the eyes. Eye hollows, eye bags, the whole shazam.
Yes.
And I know you have a bunch of questions for me. So I hope that this episode will be really useful for all those who are concerned that they might start to look a little bit aged around the eye area.
Yeah, I think it's one of probably our biggest concerns that we see in the clinic. No, non-surgical rhinoplasty is probably the biggest, but I'd say secondary, if not very close top, is tired eyes.
Well, non-surgical rhinoplasty is one of those that patients are they're born with. And we see all ages, right? Like patients as soon as they hit 18 who've been really bothered by it. Tired eyes, I feel, tends to be more age-related.
Yeah.
So, and obviously this is an industry that will, aesthetic medicine.
Yeah.
People want to rejuvenate and regenerate. And then one of the concerns are, I just look a little bit more tired, or what happened to my eye area? I didn't have wrinkles before and suddenly I've woken up and they're here, and I know what that feels like.
Yeah. So I suppose the biggest question is what causes tired looking eyes?
There's so many different things that can be going on around the eye area. And I think people get really confused by the term dark circles, eye bags, under eye hollows, and they're used interchangeably and they may not mean the same thing.
Yeah.
So I think it's important to differentiate what is going on so that you basically have the right treatment.
Yeah.
So first and foremost, I think that one of the most common is hollows under the eyes.
Yes.
And hollows can be genetic. So you might just be genetically predisposed to having hollows under your eyes. It's certainly more common in patients who are Asian.
Okay.
So patients who are maybe Arab, Asian, Pakistani, Indian. And that is partly because because of the heritage.
Yeah.
The genetic predisposition is that they lose the infraorbital fat pad quicker.
Okay.
And they get hollowing under the eyes or deep set eyes quicker.
Okay.
And this can be even in teenagers. So teenagers who often will come and say, my eyes are really set back and I look like I've got dark panda eyes or dark circles around my eyes. People tell me I'm tired. People ask me, are you tired? Or, even when they've had 8 hours of sleep. So that's a really common thing that I see. And that's probably the easiest thing to treat.
Yeah.
Because if you have eye hollows, then by definition, your bone is sitting slightly further back.
Okay.
And remember, the skin around the eyes is 1/10 the thickness as the rest of the face. It ages much faster than anywhere else on the face. And it's one of the first signs of aging that patients will see.
Okay.
So tired looking eyes are really, really common. But eye hollows, which is a deep set eyes, is volumetric change. It's an issue with volume.
Okay.
Okay. Or the skeletal position. If you have deep set eyes, and therefore we categorize that as volume loss,
Okay.
the easiest way to treat it is volume replacement.
Yeah.
It's a no-brainer. Volume loss equals volume replacement for treatment. Now, volume replacement can come from either a surgical treatment or a non-surgical treatment.
Okay.
And a surgical treatment may be fat transfer, where they take fat out of somewhere in your body. Could be your abdomen, could be your thigh, could be your bum.
Okay.
And then it gets mixed up and then re-injected into your face under the eye area. That is called fat transfer.
Okay.
And there are, of course, benefits and there are risks associated with it. And it's not for everyone, but it works for some patients. Now, the treatments that we do in clinic are non-surgical, and definitely by far, they are much more common than surgical treatments. And in fact, the latest results and statistics that have come out from BAPS, the British Association of Plastic Surgery, have shown that surgical plastic surgery, surgical treatments and plastic surgery for reconstruction or rejuvenation, age-related changes are down 16% over the last year. So fewer and fewer people are accessing plastic surgery because of how effective non-surgical treatments are and how affordable non-surgical treatments are. So how we would treat volume loss is essentially dermal filler.
Okay.
Or soft tissue filler. And these are typically a hyaluronic acid, which is a sugar molecule that is a biodegradable gel that is injected under the eye to recreate volume and smooth out the hollows under the eye.
Okay.
So it immediately plumps up and makes the eye area look better, fresher, brighter.
Okay.
That's one thing. That's hot volume loss, or deep set eyes. Yeah. Really easy to treat. Takes minutes, doesn't cost a bombshell, but is that one of the most technically complex areas to treat. And the reason why is because the skin is so thin under the eyes. You don't have space to go wrong.
No.
And you don't have a fat pad over there that you can just hide the filler in. Unlike here, I mean, the cheeks are fat, right? The cheeks, you can place filler deep. You can place it a little bit more superficial. And really, because you've got a lot more volume, you won't see the hills and the valleys or the indentations or the variability. Yeah. With the tear trough, if you touch your tear trough, it's skin and bone.
Yeah.
There isn't much space there. It's really, and the skin itself is very, very thin, paper thin. So as soon as you're under the skin, that's it. You're seeing muscle, right? So it really isn't much space. And the muscles really tightly adhere to the underlying bone. Okay. So if you don't place filler in the right area, i.e. you don't place it under the muscle, on the bone, it will show as a bulge. It will cause fluid retention. It will cause discoloration. We call that a Tyndall effect, which is blue discoloration to the tissues. And we see this commonly, as you know, patients coming in from all over the country having treatments done elsewhere that have not gone right. And of course, complications can happen even in doctor's hands.
Yes.
The great thing is if you're using a hyaluronic acid, it can easily be sorted. A little bit of the dissolving enzyme done by a medical professional, and that should easily settle down. Yeah. But the tear trough is a technically complex area to inject, therefore finds an experienced practitioner. Yeah. But the treatment itself, isn't. It's a no-brainer. If you've got volume loss, then volume replacement is easy. Okay, now the other reason why people might be looking tired or feeling tired is because they've got pigmentation under the eyes. So the actual skin is darker than it once was, or the rest of the face. Okay. That is called pigmentation or hyperpigmentation. Yes. And if you have hyperpigmentation, again, it can be difficult to treat, but the number one thing that you must do, come rain or shine, is wear your sun protection. Yes. I know we've talked about this many, many times before, but it's really important. Yeah. It's one of those things that you just don't compromise on. No. And sun protection has been shown to be so effective that if all patients did was completely block out the sun, you could, and I mean like zero exposure to sun, 90% of hyperpigmentation resolves. So we know that hyperpigmentation is strongly related to sun exposure. Okay. It can, of course, be hormonal related, but sun exposure is a big one. So the first thing that you must do is wear your SPF. And your cream with SPF is not good enough. Your makeup with SPF is not good enough. It needs to be a standalone SPF of minimum 30, SPF 30. But I use an SPF 50 even when it's snowing or raining outside. Yes. Non-negotiable. No. So the other thing is using the right skincare. And skincare can make a big difference. Yeah. Now, there are unlicensed treatments and off-licensed treatments. And what I mean by that is where a product has been specifically designed to be used in the eye area that might be unlicensed. Okay. So, for example, when we are performing a non-surgical rhinoplasty, the majority, there's only one product on the market, one filler on the market that has an FDA approval and is licensed to be used for treatment of the nose. Yeah. The majority of people are using fillers off license in the nose. Not a big deal. Okay. The same with botulinum toxin. Sometimes people call it Botox. Botox is just a brand name. When you are injecting that, the majority of the botulinum toxins out there are not licensed for the forehead. They're only licensed for between the eyes. Okay. However, because it's prescription only, medical professionals have the clinical autonomy to prescribe an off-license treatment if it is going to benefit the patient, which is why we do use botulinum toxin for 3 areas of the face, including the forehead, which is why we also use it for masseter reduction. Yeah. We might use it for migraine treatments, sweating of the underarms. Some of them have the license for it, some of them don't. Okay. So off-license doesn't mean ineffective or won't work. It just means that it hasn't got that tick on that box. Yeah. So I do use products unlicensed and off-license for the under-eye area because I'm very experienced in the field and I've been doing this for 14 years. And one of the kind of the bog standard things that I think are very effective is vitamin C. I would say to anyone with hyperpigmentation, use vitamin C. Vitamin C in the under eye area. I'm talking about 5% vitamin C. Only in the under eye area. Even if you're acne prone, you can use it in the under eye area. Will help to improve collagen production and will help to reduce pigmentation. And in fact, vitamin C underneath your SPF has been shown to make your SPF 8 times more effective.
Wow.
So don't skip your antioxidant. Wow. The other thing that I would say is kojic acid. Kojic acid is a really good cream ingredient that can be used in your creams that can help with hyperpigmentation. Okay. But these are over-the-counter, off-license products. Prescription product is called hydroquinone.
Yes.
Now, hydroquinone traditionally in the Middle East, in Asia, has been used in stupid amounts, in unregulated volumes and percentages, which can cause actually the opposite of improvement. It can make pigmentation worse and it can make it permanent. So don't go and buy your Fair and Lovely or your hydroquinone from Dubai when you're on holiday without a prescription. It really should be no more than 4%. And it has to be done under the supervision of a doctor. And use of license, this can demonstrate improvements in the under eye area, but it is a case-by-case basis and it has to be prescribed by your doctor. Yeah. And then we've got injectables. Okay. So for patients who have something like pigmentation under the eyes, there is one particular treatment that I perform in clinic. It's the eye boost treatment that I do. And this is where I use a product called Belotero Revive, which is the only skin booster specifically licensed and proven to help with hyperpigmentation. Again, it's off license in the under eye area, but I use it for those who maybe have crepey skin under the eye area and they've got pigmentation, and it just works wonders. But it must be injected into the skin and not underneath it, because otherwise it can cause puffiness. And it's really technique sensitive. So now we've covered eye hollows and we've covered pigmentation, right? The other in-clinic treatment that can help with pigmentation is skin peels, but you've got to prep the skin. And skin peels do help because they exfoliate the upper layer of the skin. Now, there's another thing that I see a lot of, which is puffiness or eye bags, and they're not the same, but they may present to the patient as the same. They just see a bag under their eye. So there's 2 types of bags. One bag is caused by fat prolapse. So the fat is sticking out. It's also known as orbital fat herniation. And that can create this bulge. And you can't get rid of that without surgery. The best treatment for that is surgical removal. I acknowledge that not all patients will want surgery or not all patients will afford surgery. Therefore, dermal filler can be used to make it less obvious and to support it. So as you age, the ligaments that surround your eye that help your eye to move around so that you can look at people and communicate and to open and close your eyes and to help with the musculature, they become loose and lax, kind of like the elastic band around your underwear. It becomes looser and laxer with use, right? You chuck away your underwear, you can't do that with your face. So what happens is, if not everything is tight anymore, the ligaments sort of loosen, the bone is starting to resorb and shrink back. That fat pad that was once held tightly in place starts to stick forward. So you can have surgery to either reposition it or remove it. And that has its own complexities and risks. So non-surgically, filler can be used to mask it. And I do that a lot with significant improvements in quality of life. Because when you have a bag under your eye, no matter what you do, no matter how much you sleep, you look tired. And also patients often report that they look unwell. So people will often come to me and say, everyone thinks I'm sick. Or some people even say to me, I've been asked if I take drugs, which is sad. You know, it's really upsetting for patients to hear that. And sometimes even younger patients who just have this eye bulge, this fat prolapse. So it's not to be dismissed and it can be treated. Then there is puffiness caused by poor lymphatic drainage or tissue swelling. And if you have puffiness caused by that, you'll know because it gets better and worse. It might get better. It might be worse as soon as you wake up because you've been lying down all night. It might get worse after having salty chips the night before or sushi or anything salty because salt results in fluid retention. And it might get worse if you're rubbing your eyes or you're allergic to something. And that can be really difficult to treat and is probably one of the most unpredictable eye scenarios to treat. And I would say less is more here. Lifestyle treatments make a big difference. Avoid salt intake. improve your lymphatics with regular lymphatic drainage treatments, and avoid too much filler. Less is more here. If you put too much filler into the eye area, remember hyaluronic acid, every molecule of hyaluronic acid holds 1,000 times its weight in water. So if you are prone to puffiness or you have puffy eyes, dermal filler is not necessarily the right treatment for you.
Okay.
And instead, I would focus on the lifestyle treatments. Now, that doesn't mean that they can't have in-clinic treatments that can help reduce it. One of which may be lymphatic drainage. The other one is radiofrequency microneedling, which is fantastic at shrinking everything down. It's almost like shrink wrapping the tissue so everything looks tighter. That puffiness looks way better.
Yeah.
And the other one is laser, CO2 laser. Fantastic for improving the eye area. Mm-hmm. And then if patients have lines and wrinkles, now I'm in that category. I'm in my late 30s. I'm aging. I'm losing collagen. Everyone is. The queen doesn't escape it. We're all aging. So lines and wrinkles around the eye area is going to happen to everyone at some stage or another. Even if you were the beauty queen of Liverpool at the age of 20, it will catch up with you eventually. It's inevitable and it's okay. If the lines and wrinkles bother you, if you're looking in the mirror and you're feeling conscious and you don't want to smile because you feel like you look aged, then you can have treatments. Yeah. And the treatments for that may be skin boosters. Okay. They may be, again, radiofrequency microneedling to resurface the skin. Radiofrequency microneedling is a treatment that is essentially creates a controlled wound in the skin and it stimulates new collagen production. And the gold standard is CO2 laser. Yeah. A laser resurfacing treatment or a non-ablative laser will really help to remodel the collagen and tighten up the tissues and is fantastic for the eye area. Mm-hmm. Then there's polynucleotides. Now, polynucleotides probably everyone has heard of now. Yes. These are little strands of DNA that are extracted from salmon fish or salmon trouts, specifically the sperm or the gonads of the trout. And they are fantastic because when they are injected into the tissues, they stimulate new collagen. Okay. And they are effective for pretty much any eye condition, any eye scenario, whether you have hollows, whether you have eye wrinkles, whether you've got laxity and even eye bags, polynucleotides have been demonstrably improve the quality of the skin and the laxity of the skin. Okay. So that's your nutshell of the various different things that people come in concerned about and what kind of treatments may help them.
Wow. There's so many different concerns, isn't there? And so many different treatments out there to help patients that we hopefully are able to help patients when they come in with their concern. So I suppose the next question would be, as we're coming into the season of hay fever and allergies, is rubbing your eyes bad?
Yes.
Okay.
Yes. When you are, and actually if you have allergies, you're more prone to concerns, lymphatic issues around the eyes. You've got a hay fever.
Yes.
It's okay. You work in the right place. Yes. We'll look after you. So if you have allergies, then you naturally are a little bit more prone to swelling. You might have histamine release, and that results in vasodilation of the blood vessels. So the blood vessels become kind of dilated, and you can get this puffiness and leakage of fluid around the area. The worst thing that you can do is rub your eyes. If you're rubbing your eyes, apart from moving your eyeball quite roughly around the eye socket, which can cause damage to the eye itself, you will end up causing leaking of the blood because you can damage the little capillaries under the eye. A little bit of blood will leak out and that can cause staining. And that staining under the eye area is called hemosiderin staining, and it can be permanent or last for years and years. And so the most important thing with hemosiderin staining is get it treated as soon as possible. So yes, rubbing your eyes is bad. If you've got allergies, I would definitely say see your GP and get your hay fever in check. But try as hard as you can to not rub your eyes. Not only will you damage your vision long term, but you will cause dark circles under your eyes and you will get puffiness and damage to the eye area. The skin under the eyes is so thin. Yeah. Any repeated pressure or rubbing can damage the blood vessels. Okay.
No rubbing this summer then. That's me up. And then I suppose the next question is, does a lack of sleep contribute to dark under eyes, hollowness, puffiness?
Yes, it does. Okay. Lack of sleep, first of all, will increase your cortisol. Sleep is essential. You know, when they say beauty sleep, it's actually it's the real deal. It's true. Sleep is, medicine. Yeah. And that is when you rejuvenate. If you don't sleep effectively, number one, you will not have the chance to rejuvenate. Number two, your cortisol will be elevated. That will result in inflammation. And number three, you're probably not going to be able to appropriately lymphatically drain the area. So you're going to get an accumulation of tissue fluid, swelling, puffiness around the eye area. And you're rubbing your eyes, you're going to get that leaking under the eyes. So definitely if you haven't slept well, you're probably going to show it in the eye area because of that edema and that tissue retention, fluid retention under the eyes.
Okay, so you need your good 8 hours.
You need your good 8 hours for so many different reasons, not just looking pretty. Your eyes, for sure. Yeah. You need it for your brain. You need, even weight loss. You know, people trying to lose weight. The number one thing we say to them is get 8 hours sleep. Sleep is medicine.
Perfect. I love sleep, so that is absolutely perfect.
Sorted,
to me. I am sorted.
Until you get your 4 children. Sophie here wants 4 children. I've got 3, and sleep hasn't been. Beauty sleep has maybe left my life for a little while, but it will come back soon.
The husbands will be on night duties. So you spoke about before about having sort of our non-licensed and licensed treatments to treat under eye treatment concerns, should I say. So do eye creams or eye sort of topical products work for concerns such as darkness, hollowness?
Under eye creams, I do recommend. Now, this is a topic of debate because some people say just take your normal moisturizers up to your face. And you can do that, but it depends on the issue, the concern, the type of skin that you have, and also the type of moisturizer. Too thick a moisturizer, and you can block the pores around the eye area. You have natural little sebaceous glands under the eye area which show up as this little whitish, almost like little dots under the eye, which is normal. And if you block that, you can actually result in an increase in the development of something called milia. Milia are where you get little keratin pearls stuck underneath the skin, and it looks like this shiny pearlesque lump under the skin. So for that reason, I prefer a thinner cream or a thinner serum that is specifically designed for the eye area. You'll notice they're not as thick as the moisturizers that you're using on the face because the skin is not as thick. The ingredients that I would recommend in an eye serum are caffeine, vitamin C, kojic acid, copper, malonic acid, and vitamin K. Vitamin K really helps with the blood circulation. Caffeine as well will help, especially if you've got dilation of the blood vessels. It will help with constriction and improvement in the lymphatics. So patients who have puffiness under the eyes will find that particularly useful. I also like a serum that has a roller ball because this eye area, you don't want to rub it. You don't really want to be massaging your creams on or rubbing your creams off. Avoid rubbing or aggressive movements around the eye area. And instead go for something gentle and a serum with a roller ball technology that will allow you to gently improve the lymphatics, the circulation, and give your eye a little bit of that wake-up call with the caffeine in it, will help to drain any excess fluid and will help with the eye area. So yes, I do think eye creams are an important part. And because the skin under the eyes is so thin, you need to look after it. You really do need to invest in a decent eye cream because that's the first thing that's going to take you to the expensive clinics. You are going to walk into a clinic at some point saying, I don't like the lines and wrinkles under my eyes. And I see this all the time. And I say, look, I can put filler in, but home care is important. So get yourself a good eye cream and an SPF. Some of my favorites are the Obagi eye serum and also Dr. Sabrina Eyes. She's a colleague of mine who's made an eye serum that has caffeine and it also has turmeric in it and it helps with hyperpigmentation and it's got roller ball technology, so it ticks all my boxes. You took my next question out my mouth. I was going to ask for lovely patients watching which would you recommend, so because there's so many on the market. It's quite scary. It is, but that's okay. Everyone's different, their budgets are different, but I think that's one of those things you don't want to skimp on. That's one of those things that you get what you pay for. I would say either the AOX eye gel from SkinCeuticals, which is a vitamin C, or the Medicate retinol. You do want a very gentle retinoid around your eye, something like a retinaldehyde, which is low irritating. The Alpha Ret Skin Better Science Eye Max is fantastic as well. The Obagi eye serum and Dr. Sabrina Eyes. I actually use a combination. I use the Dr. Sabrina Eyes in the evening. I use the Obagi eye serum every morning. I love it. I love it under makeup. It's lightweight. You don't get any pilling, which sometimes you do with thick creams. It kind of all just comes off. This is a very lightweight product, but it's got malonic acid, it's got copper, it's got caffeine, it's got all the ingredients to help with your eye area. And then I will interchangeably use the retinoids under the eye. So I've used a combination of all of the above, and if they're good enough for me, they're good enough for you.
Tried and tested, as is everything in the clinic, isn't it? Tried and tested before. Going back on our in-clinic treatments, patients often ask, how many will I need? It's a very common, I know from being on the phone, how many will I need?
Yeah.
I know there's not a definite answer to that, but on average, what would your...
Okay. So this is so bespoke, right?
Yes.
Because everyone walks in with a different shape face and different depth of volume loss and different depth of eye sockets and different extents of sun damage and different amounts of hyperpigmentation. So there's no one size fits all here, or no straightforward answer I can give you. But I will tell you what we often see.
Yes.
If you have, and we grade tear troughs, you know, and without getting too technically complex, you can have a grade 1, grade 2, grade 3, grade 4 tear trough. If you have a severe eye hollow under the eye with volume loss on your cheek, so the eye hollow extends and you get this line across the cheek.
Okay.
We call that the mid-cheek groove. Then you probably need more than one treatment, because we'll need to replace volume in the cheek first to support the under eye, then place filler into the actual eye hollow. Yeah. On average, patients will need somewhere between 1 to 3 treatments. Okay. And that depends on their volume loss and also their response to treatment. Not everyone is the same. Yeah. The same way, if I gave you paracetamol and I gave the next person paracetamol, you would not react the same. It's the same with filler. But we don't overtreat because, again, the eye area is a very delicate area. The last thing you want to do is compromise lymphatics or overfill. You can't afford to do that in the eye area. So the maximum I would place at any one time is 0.5 mil in the eye area. Okay. If you place more than that, you will compromise lymphatics and you will likely get lumps, bumps, and distortion to the tissues. Okay. So less is more. We'd rather put 0.5 mil, leave it for 4 to 6 weeks, because we know that over the course of 4 to 6 weeks, first of all, your natural swelling will decrease, and the filler will start to integrate, but also the fluid uptake that filler will attract to the area, that continues, and in fact, it continues to 6 months, 3 months. But the kind of the immediate sucking in of that fluid, that sponge-like effect, happens in the first 4 to 6 weeks. So you want to wait until that hydrophilic effect is complete, so that you can see the end result. What we know now that we didn't know before is that if I place 0.5 mil in you today, in 6 weeks, you're not going to have a 0.5 mil improvement. You're probably going to have 1 mil of improvement, because half of that improvement is coming from the filler. The other half is coming from the volumetric change from the fluids that's been attracted. And fluid isn't necessarily a bad thing. No. If you've got volume loss, actually having hydrated eyes, perfect. Having hydrated cheeks, wonderful. You want hydration in the under eye area and the cheeks and anywhere else that you have filler. But that's why less is more, because filler injected on the day is not the same, will not give you an accurate assessment of what the end result will look like, because it will take up more fluid and you cannot accurately assess the end result until 4 to 6 weeks down the line. So it's important that you don't over-inject in the first instance. It will take up fluid and it will look better. You just need the medicine called patience.
Yes. Okay. And sort of leading on from that, can patients combine treatments? So patients may come to us with some pigmentation and some hollowness. So can they combine them? Is
Absolutely.
It safe to do so?
You can have filler, you can have radiofrequency microneedling, you can have sublative radiofrequency, you can have CO2 laser, and you can have polynucleotides. Most patients will need a combination of treatments. Yeah. And if budget is a constraint, then you pick the one that's going to give you the most bang for your buck.
Yes.
Like I said, if it's eye hollow, if you've got volume loss, you need the volume replacement. But if you've got lines and wrinkles, maybe you want to have some polynucleotides to stimulate collagen and then CO2 laser. Yeah. So combination treatments will always yield best results. It's that cumulative effect that gives you the magic.
Perfect. So recently on your Instagram, I've seen a reel about mid-cheek groove. Yes. And I know often that goes hand in hand with an under-eye treatment. Yes. Can you tell me more about it?
Okay, probably the most vital question and the most common presentation. Yeah. A mid-cheek groove, also known as a nasojugal groove, is a line that goes from the inner aspect of the eye right down onto the tear trough and then onto the cheek. So they have this indentation on the middle of the face, which is a continuous line from the tear trough hollow or the eye area depression onto the cheek. Okay. Most people call that a mid-cheek groove or a nasojugal groove. Some people call it a malar groove. It's all the same thing. Okay. And that can be caused by a number of different things, including excess fluid in the area. It can be caused by excess fat in the area, or aging. And it can be hereditary. And it can be made worse with fillers placed in the wrong place. So if you have a mid-cheek groove, It's not all doom and gloom, but it does mean that you have some level of volume loss in the cheek, and it would be completely negligent and irresponsible and ineffective to place filler in the tear trough before placing it in the cheek. The cheek is a pedestal upon which the tear trough sits. And what I mean by that is a support system. Okay.
Scaffold.
It's like the scaffold. And if you try and put tear trough filler in when you've got a flat cheek or a mid-cheek groove, you're going to look very unnatural, and the eye filler may bulge. So I would strongly recommend you don't do that. If you have a mid-cheek groove or any volume loss in the cheek, first place filler there. And in fact, we call that an indirect tear trough, because research has shown when you place filler into the cheek area, it actually, because it sucks fluid into the area, it actually hydrates the entire area and plumps up the tissues and lifts the tear trough, therefore improving the under eye hollow. And many patients will not need tear trough filler or will need much less filler in the tear trough. So if you come in and you say, I feel like I look really tired, I hate my tear troughs, and we see that you've got this mid-cheek groove, then the first thing that we would do is replace the volume loss in the mid-cheek. And guess what? You might not even need tear trough filler, because over the next 4 to 6 weeks, that filler will attract more water, will plump up the tissues, and your eye area will look much better.
I suppose one of the other questions patients have, is how do they stop it from getting worse? Can they stop it from getting worse?
You can't stop aging. Okay, we can't press pause on aging. We can magically, with our injectables and our treatments, reverse aging. But you can't really do anything to completely stop it. However, like I said, lifestyle treatments do make a difference. If you've got puffiness, then make sure you're getting your 8 hours of sleep. Avoid rubbing your eyes. That's probably the worst thing that you can do. Stay hydrated. The more you drink, the less you're going to get fluid retention. And avoid salty foods if you can. Your SPF is a non-negotiable. Honestly, that is and I have to say again and re-emphasize that having SPF in your makeup is not the same as having a standalone SPF. So if there's one thing that you're going to do, it's protect your delicate eye area with sun protection. And if you can invest in another sun cream or another cream, then I would say get yourself a bespoke eye cream that will be specifically suited to your concern.
Okay, perfect. Thank you for sharing.
Thank you for asking me.
No problem.